Reusing the urine sample cup to attempt another clean catch. Can I rinse out the clear plastic urine collection cup if the amount of urine collected is not enough and I have to try again? What do I use to not contaminate another sample? Also, there was only one antiseptic towelette provided, so what can I use again? I tried to buy a box at CVS but they did not sell them. Can I use baby wipes, or does the aloe or soap contaminate the urine sample as well? How else can I wash the area before trying to get another urine sample if the lab only gave me one towelette to wipe with before collecting the urine sample and one collection cup? What else can I use?
Hi there. Board certified Obgyn here. Unfortunately, you cannot just rinse out the collection cup and use it again. You will need to request a new one and the lab should provide it to you. If the antiseptic towelette is not enough, an unscented baby wipe will do the trick. The tiny towelette they give you should be enough if they only provide you with one. I tell patients just to wipe once from front to back and then sit down and pee. I know it's hard to angle it in there. Good luck.
This is the challenge. My mom has a prolapse bladder in addition to using special tea called Smooth Move, which sometimes creates some bowel spotting throughout the day that I am increasing the Smooth Move tea. I have learned that letting the urine flow a bit and only after that, to collect a clean catch. Do you really think the catch is clean in this case? I also have a bidet and a handheld sprayer attached to the shower head. So the aloe or gentle oils or soaps used in the baby wipe leave a residue that contaminates the sample?
Exactly. A clean catch is where you let a little urine flow out and then collect after letting that initial bit of urine go. The catch is as clean as it will get in this case. I do not think you need to use the bidet or shower head. We ask patients of all ages for clean catch specimens all the time, and they use the bathroom in the waiting room. The baby wipes should be fine. The reason we do a clean catch is to do our best to avoid catching all the normal bacteria that grow in the vagina and on the skin, because it can affect how the urine looks when we dip it to test for the presence of certain cells. Regardless of how the urine looks, it will not grow bacteria if there is not actually bacteria in the urine. That is called a UTI or urinary tract infection. We know that a clean catch isn't perfectly clean, but for the vast majority of patients it is adequate to get the information we need.
Where else can I purchase urine cups to guarantee I can get a sample, because my mom is incontinent because of neurology issues and often pees herself when I am pulling down the diapers, and getting enough urine in time before it drips out everywhere has been difficult this past week.
I see. Honestly, I would say do the best you can. You do not need to purchase the urine cups. You can ask your doc or the lab just to provide you with a couple extra so you have a few chances to collect. If you really are having a hard time with it, your doc may just bring your mom in for a catheterized specimen. It is slightly more uncomfortable, but will definitely give them the info they need if they're worried she has UTI. And I would not stress about letting some urine go first to make it clean catch. In your scenario, I would say just do the best you can to collect some urine.
I don't think she has a UTI, but the dipsticks always come out positive ever since stopping probiotics for a month when a particular MD wanted to do a fecal test. The directions on the kit stated to stop all probiotics for 1 month. He didn't even realize that was part of the directions. It was after that when my mom's urine test strips stopped coming out negative. I used to simply do 2 tubs or mannose powder from UTI Vibrance and her urine nitrites would come out negative. But after stopping probiotics, that is not the case. Does that make sense? And why can't I just rinse the collection cup with hot boiled water or alcohol and then let it air dry? Or will the airborne bacteria contaminate the container as well? There's no fever, no anger. She can hold 16 ounces of urine for 2 hours, I am thinking, because that is how much she drinks from the moment she wakes around 10 till approx noon, and her pull-up is dry when I get her to the toilet. Typically a true UTI causes someone to leak continuously, is that correct?
You could rinse the cup out then wipe it down with alcohol if you wanted to reuse the same cup. No part of the whole entire process of a clean catch sample is sterile, so it really doesn't matter. If you really wanted to be absolutely sure about the urine you're collecting, a catheterized sample of urine is the best way to check, but it may not be worth putting her through that if the suspicion for UTI is low. UTIs do not necessarily cause continuous leakage.
Oh. UTIs don't have the symptom of frequent urination?
Sometimes they do, but not always.
Well, how do we know if it's just bacteria lining the urethra or flowing in the bladder that is permeating from the bowel organs but it doesn't get into the nervous system, or does the bad bacteria always get into the body and damage it even in small doses but now showing symptoms? So we think it is just dementia or memory loss or Alzheimer's or Parkinson's or other diseases, yet it stems from bacteria in the bladder? How do we know how to not use antibiotics causing yeast infections, because I finally got rid of my mom's itching and don't want to treat for UTI if there is none? But most importantly is that I can rinse the container with soap and water first and then use alcohol? The alcohol residue or essence won't contaminate the bacteria or whatever is floating in the urine? Or alcohol remaining inside the screw-on cap of the container that I might have missed?
The best way to rule out a UTI for sure would be to get a catheterized specimen, inserting a catheter in the bladder to collect some urine, then removing the catheter. Your mother's doc knows her well enough to determine if that's necessary. Again, no part of the clean catch process of collecting urine is sterile. Ideally, you'd use a new cup each time you collected to minimize the risk of contamination, but there's very little harm in washing out a cup then wiping with alcohol.
Okay, that's what I've been doing, but often she has gone in her pull-up where nothing comes out until 5 minutes later after she has been sitting for a while, and I hear the tinkle and can't get the cup under her fast enough. So I only get 1/8 of an inch. Is that enough? We gave up on trying to get a glucose test and only concentrating on urine culture. The cup is approx the diameter of a 1/2 in diameter. Can the lab do their culture test with that little? Catheter is out of the question. That only poses more chance of infection and stress and fussing and fear in a frail person. There must be other markers to identify when and if bacteria is having negative effects on a person, aren't there?
You can call the lab or take the cup into the lab to see if it's enough. Every lab is different. You can ask your doc if there are other tests to do. It's so hard to know in elderly people.
If I find an old cup from half a year ago in the bathroom and it was opened once but never actually used to collect urine, can that cup be used, or does it have to be washed? It was probably supposed to be used and never made it, but simply opened and closed again since the sample ended up in the diaper instead.
I'd use it.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.